Okay, let's get started because I think we have critical mass going. My name's Kate Cohen. I am filling in for Colleen today and for Allie, so sorry in advance for a lot of me talking. But I work with the Colorado Department of Public Health and Environment in the Violence and Injury Prevention Mental Health Promotion branch, working on communications and policy. And so I'm going to be talking a little bit more today about our policy work and kind of what's going on in other states. But because I'm filling in, please feel free to chime in at any point, and please do. I'd love it if folks participated a whole bunch. This is the Plains to Peak Learning Opportunity, January 27th, and we're going to be talking a little bit more about legislative priorities in folk states. But let's start off with introductions. So again, big part of my role working on communications and policy is kind of strategizing around how we're communicating with partners around the state and working with folks around some of our legislative priorities. And then I also do a lot of writing help and design work, but I work with Allie Maffey, who couldn't be here today to give this presentation. So I'm excited to talk to everyone about policy today, but I'm just going to go down the list. So Mandy, do you want to go next?
Sorry. Hi, everyone. Mandy Slag, North Dakota Department of Health. I'm the Injury Prevention Program Director.
Great. Dana?
Hi, this is Dana Zolk. I'm the Section Director for Injury and Violence Prevention Programs here at the Kansas Department of Health and Environment.
Thanks. Jean? Oh, I think you're on mute. Or it doesn't look like you're on mute, but I just can't hear you.
Okay.
There we go.
Thanks. Sorry, thank you. Jeannie Beats,
Jeannie, sorry.
Services, Injury Prevention Program, and I am the Motor Vehicle Safety Coordinator.
Great, thanks, Jeannie. Felice?
Hello, good morning. Felice Senior here with the Colorado Department of Public Health and Environment, and I am a Violence and Injury Prevention Evaluator.
Thanks, Felice. Sarah?
Hi, everyone. Sarah Brandspiegel. I am with the Colorado School of Public Health in Denver, Colorado, and we partner with the State Health Department on a number of different topics, including the National Peer Learning Team on Child Maltreatment Prevention and this effort as well.
Thanks. Peg?
Hello, I'm Peg Ginsburg. I'm the Injury Prevention Program Manager in Nebraska. I could go stick my face behind Jeannie if you guys wanted to see me, but but I don't have a camera on my computer, so I'll just listen.
That's totally fine. Deanna?
Hi, this is Deanna. I'm an epidemiologist evaluator in Utah.
Thanks. Keisha?
Hi everyone, this is Keisha Hampton. I am the project officer for Region 7 and 8, and I'm working closely with Colorado.
Ashley? I don't know if you are trying to talk, but you're on mute. Okay, let's move on to Tiffany for now.
Hi, this is Tiffany Conroy. I'm the Injury Prevention Program Manager at the Iowa Department of Public Health.
Thanks. And are Ashley or other folks that are on the line, do you want to introduce yourselves? I see a couple phone numbers here, but no names. We'll just give shout out to anyone to jump right in.
Hi, this is Lisa Peterson with Department of Health and Senior Services, and I'm the Injury Prevention Coordinator.
And this is Susie McGee. I'm with CDC on the evaluation team, and I work closely on the RNCO and NPLT evaluations. So thank you for having me.
Great. Thanks for being here. anyone, oh, here we go. No problem. So Ashley says that she works with as the motor vehicle program coordinator at CDPHE. So thanks, Ashley. I'll try to keep an eye on the chats, but full disclaimer, I might get distracted by the conversation at some points. But just to reiterate, so I am Kate Cohen. I am filling in for both Colleen and Allie Maffey today, facilitating this webinar. They couldn't be here, but I'm excited to talk to folks about policy. So just before I move on, I saw other folks on the phone. Anyone else that I missed that jumped on late? Okay, great. So I'm just going to share my screen. 1 second. There we go. Okay, so today I want to spend some time talking about our current legislative priorities in each of our states, and I would love for this to be more of a discussion than a presentation. So I definitely want to hear what's happening in everyone's states on your legislative agendas and any lessons learned or resources to share, or just what folks are up to. So just before I dive in, is everyone currently in a legislative session right now in their states, or is there anyone who's not?
North Dakota is not. We do budget only on the even years, and then some interim committees. We do not have full legislative session on the even years.
Okay. Well, that'll still, I'm sure, be really interesting to hear about, because I'm sure there's a lot of strategizing and things that happen behind the scenes, especially when we're out of session. So feel free to, share anything from that as well.
I will.
Anyone else not currently in a legislative session right now? Well, Colorado started about 3 weeks ago, so we're definitely in it now with a lot of legislation that's already been introduced. So I'm excited to hear about what other folks are working on. Let's see. So the framework that we use comes from CDC's policy guide for state health departments doing policy work. So we're going to use this to talk through the work that we're doing. And as you can see, the stakeholder engagement and education piece is just always at the center. So in every phase of this, we should always be engaging stakeholders in the work that we do. But we always start with the public will piece. So problem identification and policy analysis, and figuring out what do we know actually works, and then move to political will, where we see strategy and policy development, and then obviously actually getting the policy enacted, which is really hard work, and it's hard to get to that phase. So we'll use this framework to guide our discussion today and what we've seen in our states. And we know that what we know works from our standpoint, and political agendas might be at odds with each other. Political agendas are often include legislator strategies and policies that they're working on, and those just might not be the same as the ones that we're working on or the public's working on. And oftentimes there's a lot of different viewpoints that are coming into play. So in politics, nothing happens by accident. If it happens, you can bet it was planned that way. I think what's really important here is that there's just always work and strategizing going on behind the scenes. So like I was just saying to Mandy, I'm sure that I know that on our off years, or sorry, we don't have off years, but on our, in the middle of the legislative sessions, there's often a long-term strategy or a lot of work that goes into play from everyone involved that culminates in whatever is happening in the actual legislative session and what we see publicly. So nothing is ever random. So problem identification. This is something that I think in public health we need to spend more time on than we think often. So thinking about leading up to the legislative sessions, what are the problems that are being identified? Because this is the first step, is to figure out what we as public health professionals or others in the field would want to see as solutions. So for Colorado, some of the common problems here around our budget issues, especially because in Colorado, we tend to have a tighter budget with TABOR and the Taxpayer Bill of Rights, and the fact that we just have less money to spend. And then the governor has also set a lot of priorities around problems he wants to see addressed around public health, like suicide, healthcare costs, healthy eating, active living. And then housing is a really big issue here, as I'm sure it is in all of your states as well. And one thing, this is our second legislative session with our governor, the governor that we have right now. And I think last session we saw him drive a lot of the priorities that were enacted, and I'm sure that we'll probably see a lot of that happening and at play this session as well. So this piece is something to spend some time on to figure out what the problems are in your state and what you think are going to be addressed in the coming legislative session. Then policy analysis. So this is all about thinking through the solutions to the problems you've identified, and these solutions are not just research-based or informed, although we might often want them to be, always want them to be, but they're also inherently political. So even though we might know that there is a really easy solution, or maybe not easy, but a very obvious solution when it comes to a public health practice for a problem that we're working on, it might not be politically feasible. And that's something that we have to take into consideration when we're thinking about what's going to make policy agendas during the session. How solutions are analyzed depends largely on the political landscape in your state. So thinking through, what does the data say about our issues, and what is the public perception of our issues? So what I often see is that the data usually points to a systems level solution or a state level solution, but often problems get framed as individual level problems, and that kind of becomes public perception. So, we're not working on it in this session, but for example, with primary seatbelt, when we think about people wearing their seatbelt, a lot of folks think about it, well, that's, just decide to wear their seatbelts. And that's, I think, because of just how the issue's been framed, and that our kind of devotion in Colorado to this value of individualism. And that becomes problematic if we're advocating, which we're not at the moment, but if we're advocating at a state level for state level solution to the problem for primary seatbelt. Another example is that the data might say that suicide is an issue for white working age males, but the perception largely in the state is that we have a bigger teen issue in Colorado. So there's often this tension between the data and the public perception. And then, of course, what legislators have the political will to actually address. Are they willing to go out on a limb, or is this part of their agenda already? And what are all of the different players' values and priorities, which could vary depending on different stakeholders, public health, the public itself, and then also political leaders. So all of these components will lead to how we analyze solutions. So for these components, what did you all see coming up in your states leading up to the legislative session? Who was at play, or were there folks that were at odds with each other when it comes to values and their priorities? Does anyone have anything here to add?
This is Deanna in Utah. I don't work that closely with a lot of the legislatures or the relationship that our program has with it, so I don't have much to add to this. I do know that they ask our program for a lot of data, both leading up to the session and then just if we do receive any state funds. And there is often, of course, changes to bills that happens that might change how the bill is carried out that our program either does or does not agree with. And we try to track that as a program.
That's great. Yeah, I've seen a lot of legislation come up recently in Colorado that's just, yes, making some minor changes to definitions or how we're addressing something in another bill that passed last session. That happens a lot. Maybe a slightly different question. what problems have been prioritized in your state and what solutions are being proposed? And I mean, I think one thing that I'd be interested to hear is, are they the solutions that you think are, you know, evidence-based, or kind of where are they coming from? If folks could share, that would be great.
Hi, Kate. This is Mandy in North Dakota. As soon as the 2017 legislative session concluded, the Department of Transportation, along with key partners, are working on a bill to introduce the primary seatbelt law again. It was introduced in the 2017 legislative session. It passed in the Senate and then failed in the House. I guess going back to your previous slide, the climate is, or the perception is, that we have a lot of older legislators in our state that have been legislators for like 20, 25 years. So their perception is still that they have these stories that were shared last session about how if their friend had been wearing their seatbelt, they would have burned in the car and those different types of things. So that's still their perception, that seatbelts don't always save lives. And one legislator actually, our seatbelt rate is about 81% in North Dakota. And some of them felt that 81% was good enough and we didn't need a primary seatbelt law. So I'm not sure exactly how they're going to tackle it for the next legislative session, but hopefully. And there was great support from the Republicans in our state that signed on to the bill as sponsors. So not really sure where things went wrong, but that's what happened to us, and that's a priority that I know is going to come forward again.
That's so interesting, though, and really highlights how, depending on what the narrative is coming from, you know, testimonies or what we're hearing, that it just completely changes the conversation. Like that legislators are thinking about, well, what happens if somebody is staying in the car, you know, when they're belted in. I don't think I've heard that before from our folks in the state.
Well, to me, it was kind of interesting because no one testified against the primary ballot law. No one from the public did in either the House or the Senate. And there's still that perception from some of the legislators.
Yeah, and ours is, oh,
yeah,
sorry.
Go ahead.
This is Maureen in Montana. I was just going to say, much like our friends in North Dakota, I would say ours was pretty much the exact same story, different state. We've put it forward the last 11 legislatures to have a primary seatbelt law, but perceptions in Montana are similar to North Dakota. Again, we even a Republican carried the bill, and it didn't even make it out of committee, even though, again, no negative testimony, everything was positive. But we also went forward with like sort of a positive messaging campaign, which included the statistic that I think ours is 84% instead of 81, but you know, and they're like, well, that's good enough. And it never even got enough traction to make it out of committee this last time. So
where do you think that perception from legislators is coming from if nobody's speaking up against it?
I think it's independent freedoms. You know, I mean, I think we're a Western state and there's still that like, well, you know, it's just one more reason for the police to pull us over, I think is a piece of it for the Montana crew anyway. And again, some of those long-term legislators that just don't see it as a priority.
This is Mandy again. It's pretty similar to what Maureen said in North Dakota, like Montana. However, we do have those legislators that also feel that it's, you know, a personal right to choose whether or not you want to buckle up, and North Dakotans can choose for themselves because they're smart enough to do so, and we don't need to have a law that tells them that they have to buckle up. That was a couple of the legislators had mentioned that in session.
Yeah, and I know that's a really hard frame to overpower when you're hearing that, especially in this part of the country. And it's interesting how, especially so we're not tackling this issue right now. And a big part of this is because of our political situation here in Colorado, where we know that it's just not, we don't have, we have some public perception, I think, that this is a problem, but similarly to your states, that it's not necessarily a problem that we can or want to address on a state level. But it's just kind of the worst time politically because our governor isn't in support of it and legislators aren't in support of it. So nobody wants to run the bill. So it's just something that we've decided, oh, okay, this doesn't require, or this doesn't deserve political capital from us to work on right now. And we need to wait for a more opportune moment and to address it. And similarly, we also saw a distracted driving bill fail last year, which was reintroduced this year. And it's really interesting to see how politics are at play because, you know, I think especially for bills like this, where we kind of introduce year after year, we have to be looking for what might be changing in the political landscape that would actually yield a different result, you know, and not just continuously put this policy forward if we have the exact same legislative makeup and the exact same legislators. And so for distracted driving, you know, it's going to be interesting to see how it plays out, if it's different from last year or not, on whether it moves forward. But yeah, so that's something that I always am interested in. If, you know, for something like primary seatbelt, are we looking at what's changing and what might be make it an opportune time? Or are we just kind of building a steady drumbeat of support, or what's the strategy? But what about others? What other problems have been prioritized in your states?
Jeannie, here in Nebraska, we're kind of, seems like everybody has kind of the same theme. Here it's really about, and I've heard other people say this before, it's about the freedom and freedom to choose, and that my choice doesn't affect anybody. It's my choice to die and it doesn't affect anybody, which we all know that's not the case. We've had, you know, seatbelt and distracted driving laws put forth in our transportation committee, and they've never, they've never got out of committee to be heard on our floor. We have a unicameral, so we just have one body. The one that always gets out, that has always gotten out for the last 20 years, is the repeal of our motorcycle helmet law, because once again, that's infringing on people's freedoms to decide whether or not they want to wear a motorcycle helmet. And it's just always an interesting struggle because we have all the data to prove otherwise, but you know, you've got ABATE that's in there talking with their senators every year, and it always gets on the agenda. Distracted driving for us this year was we were a little more hopeful because senators were really asking a lot of questions in committee, and we thought, okay, this might go somewhere, but it's still sitting in committee. And so we think that maybe, like, we do have a primary seatbelt law as well sitting there, but I'm thinking that we just improved, a year ago we approved our child passenger safety law to cover kids up to age 8. So we're thinking maybe we could get primary enforcement for 8 to 18 or 19 to say, hey, we're protecting our kids, and we can still let our adults make that decision. So it's kind of, we maybe need to take off smaller chunks when it comes to that part. But all the while we're spending all of our time trying to keep our motorcycle helmet law intact. So that was one of the ones. It's not a solution. It's not a good solution that's being proposed. But the other interesting thing too here is that property taxes is really an issue here, and so you just kind of wonder how much time is going to be spent on these different topics and all the new bills that were introduced this year on our end with school buses, children being left in vehicles. You just don't know if those will go any further. And here it seems we do have some champions that do believe in safety and injury prevention and health for Nebraska, but a lot of them really continue to kind of ignore the information that they're provided. So that's kind of frustrating. Just like some of the other states, you don't hear anybody testifying against any of this stuff, but yet it can't even get out of committee. So if anybody has advice, we'll take it.
I had a thought about just hearing you all talk about, the primary seatbelt and the issue of, not wanting to kind of infringe on people's individual rights. And I was thinking about the success with tobacco legislation and how that really, the tide started to turn when we started to think about secondhand smoke and how that infringes on other people's right to, not be impacted negatively by that. And we have this campaign, I'm not sure if it's currently active at the moment, but called Beware the Unbelted. And just the idea that people who are not wearing a seatbelt become projectiles that can actually harm other people in the vehicle. And so I don't know, I'm just kind of like, this idea just kind of occurred to me of like, well, that's, similar to the secondhand smoke piece, and that you have, an individual's choice that actually can impact other people in a very, very real way. So just throwing it out there.
That's a great point. Like, what else is there that that we could use? I like the Beware Unbelted. I think that's catchy. And what are other strategies that we can use to flip the frame for how people see this issue? So yeah, I think that's a good one, police. And then I also was thinking the other strategic piece that I heard was, attaching the primary for 8 to 19-year-olds to a bill that, or an issue that legislators are already working on, thinking about the landscape that's already there and trying to figure out how we can strategically bite off a piece and attach it to that legislation or as an idea. And then I think the issue of legislators ignoring information that's being provided, and I kind of think, I think we, especially as public health professionals, obviously have a particular role and limitations to our role, but just in general, I think one thing that can be done when legislators are not necessarily hearing from their constituents, and for whatever reason, they have this perception that, we need to repeal motorcycle helmet laws, or that the public doesn't want primary seatbelt or whatever, because I think that, at least in Colorado, for example, a lot of the public does support primary seatbelt legislation. But maybe legislators hearing from those constituents. And so if they were hearing from them more and combining that with the data that they were hearing, that is public health's role to often provide, that might make a difference. So just thinking through strategically, who are the legislators hearing from? And so what is the public perception, and what do legislators think the public perception is? Because maybe those two are at odds with each other. And there's something that either we or partners can do to facilitate getting to the truth of that. What else? What other problems? Maybe non-motor vehicle examples. Not that motor vehicle isn't great, but any other examples of what problems have been prioritized in your states this session or recently?
I'm curious if any other states have had bans on conversion therapy go through. I know we recently did, but just because it's a topic that I'm interested in.
This is Deanna in Utah. We did recently have a ban on conversion therapy go through. I don't know the details of the policy or how it passed, so I would have to look that up. If it's something you're interested in, it could follow up with you offline.
Yeah, I mean, I could look it up too, but yeah, thank you. That's great.
So one of the laws we recently had to go through, this is Maureen in Montana, that now we're not really sure what to do with, is a safe harbor law for pregnant women seeking help with substance use disorders. They amended the current law just basically saying that there was a safe harbor for women seeking treatment, but they didn't remove any of the provisions around, if they're in possession of substances. So there's a lot of confusion right now about how we should be educating the various constituencies that would be interacting with the pregnant women and what this might mean. And it seems like the bill passed, and then in the last, whatever, almost year, nobody's doing anything with it. So we've just been recently having discussions to say, should we start educating Child Protective Services and, the courts and the drug courts, and, just trying to figure out who are the audiences. Have any of you had laws like this? What are you doing as public health folks to help promote it or educate folks? Question mark.
That's a really great question. I don't have any examples, but I'm wondering if folks have even similar examples that maybe they could share as share what they've done. It have to be exactly a safe harbor for pregnant women with substance use issues. Sounds like that's a really unique problem. Sorry that folks don't have examples.
All right, well, I'll keep everybody posted on how it goes.
Yeah, we'll have to learn from you. But I mean, I think that is a really hard problem, and what's our role and what, how we interplay with other agencies to make sure that folks are getting the education that they need, both about pending legislation and also, I think, after the fact, if something like that is enacted, how do we get information out to stakeholders? We did, this is a very different topic, but so last year we had a couple of marijuana bills passed that basically changed the rules a little bit for how, other folks from Colorado, feel free to jump in because I can't remember the details about this, but basically how different cities and towns had authority to regulate how marijuana was being sold. And anyway, so that legislation was pretty confusing. And so some folks from our communications team put together a document that kind of mapped out all of the different choices that towns now had to opt into that legislation. And so it was a really cool visual that I can try to share. I think that that's public now, but I'll double check. And it's a totally different issue, but just I think really helpful to explain in a visual way what new legislation is going to mean for the public.
Was that the local control for the taxation?
Yeah, I think so. Thank you.
Yeah. Right, because we don't have that for alcohol, which is interesting. So.
Anything else anyone has to add here? Okay. Well, let's move on to strategy and policy development and how we get our solution heard. So what we see as a data-driven solution is often at odds with what maybe the political will is or what public perception is, just like we've been talking about. And what you're doing to drive your solution can vary depending on, I think, your role, obviously, and your limitations. But we also have to think a lot about the political agenda. So typically, it's not necessarily the public health problem or solution that's being heard the loudest. Again, feels like a theme in particular in states that really value individual freedom. But so we have to think through whose problems and whose solutions actually are being heard. And what events are bringing these problems and solutions to the forefront? Are there particular current events that might make it easier to act on, easier for legislators to act on, distracted driving if we see some kind of high profile case, for example. And then who is making formal and public complaints that are being heard and then shifting the agenda? Those folks that are in the room, maybe advocating for motorcycle helmet repeals. Who are those people, for example, that might shift how legislators are looking at these issues? And then sometimes research drives the agenda. Sometimes, and this can definitely be harder to frame, but sometimes we can get data to really drive the agenda. But timing is really everything. So we have to think through what else is on legislators' agenda that's competing for their attention. And is it a good time to introduce whatever, for partners to introduce whatever issue we think is a problem or whatever solution we think is best. And then what's the best time to meet with folks? A lot of times in our roles, we have major limitations during the legislative session. So if we want partners to, or we want to be engaged in those conversations, it has to happen outside of sessions. And then, you know, when is the best time to talk to folks who might be champions? You know, we just lost someone in our this legislative session who is taking retirement early because of an illness that she has, which really, so she's been driving a lot of the motor vehicle legislation that we've seen, and that really has a huge impact on any potential motor vehicle solutions that we're going to see this session, because she's been largely the champion in years past, and there's really not someone who is standing up as a champion of motor vehicle legislation right now. So we have to think through the players that we have and what they have to gain from working on these issues. A lot of folks might be in play it safe mode because they're facing re-election, or maybe they're willing to take a bigger risk because they're leaving office. And so doing our homework is really important, because this is going to vary so much depending on what issue we're working on and who's been engaged in the past and what different state landscapes look like. So I'd love to hear from all of you what major political changes are driving your state's agendas, and who's leading the conversations about the solutions. Who's kind of in charge of that, or who are folks listening to? What do people think? Or even on the national level?
I feel like at the national level, we're pretty obsessed with the impeachment trial right now. I don't know that we can see the forest for all the trees.
Yeah, that's a really good example of something major happening that doesn't really have anything to do with maybe the issues that we're working on, but it's super distracting when it comes to driving any issues forward.
Yeah, absolutely.
Thanks, Elise.
Yeah, in Montana, I think it's tough because we're a biennial legislature, so we don't have one this year, and then it's also an election year, and our governor is terming out. So we're not sure who's going to be in the governor's office by the time we get to our next legislature in January of next year. So I think we're just kind of holding our breath to see which way our legislature swings for the coming year, because that will probably make a big determination on what sorts of things we're going to push through in the next legislative session as a department.
How do you feel like that's impacting folks' moves right now and what they're willing to stick their necks out for?
Well, I mean, again, I'm not about impeachment, but we're up to our eyeballs in the overdose data to action right now. So I think we're just staying busy with overdose education and really getting our strategies out there. So, I mean, that's what we're staying busy with. There's a lot of talk around substance use disorders still, not necessarily from a legislative standpoint at this point, but just sort of pushing forward and moving forward some of the initiatives that came from the last legislative session, and then from all of the dollars coming in for all of the opioid monies. So that's really been a focus for a lot of us, at least within the Department of Public Health right now. You know, and I'm low enough on the totem pole that I'm not every day in the legislative part of the conversations, but you know, meth just continues to come up as a conversation too, that we need to be doing more about meth in our state. So that is something that, you know, we're looking for from a funding aspect, so that we can do some more in that area.
Yeah, and that seems like also really leveraging what's happening on the political level with where your grants are coming from and all of these other issues to be efficient with your time. So that sounds very strategic. What else?
This is Jeannie. In Nebraska, I think overall, like, kind of the structure of how our governor wants to run things is more business-like, and so, you know, it's all about, even though saving lives would help save money, it's just there's no connection between the two, and so their focus is really on, you know, they've been we voted on Medicaid expansion, and that's been over like 2 years ago, and things keep getting drug out and not implemented, and so you can definitely see where the effort is being put into that, and also kind of with, especially our governor he still believes that seatbelts are kind of if you choose to wear it, you can wear it. The other thing, besides like the Medicaid, it's just everything is kind of more business-like. It's kind of a different environment than I've ever worked with in public health, and so we're really not. Public health isn't seen as important until you have a flu outbreak or something major happens. And so there's not a lot of underlying support, you know, compared to like right now our prison systems are overloaded. They've got to figure out what to do with that. And so there's a lot of other kind of societal problems that are needing to be addressed. And so I think that really is what drives a lot of what's going on here, and trying to get different types of policy passed is very difficult because they're having to spend time on some of these other issues.
Thanks for sharing that. I think that's a big tension in all of our states too, you know, where it's just there's so many high profile, high impact issues that draw the attention of a lot of legislators and the public, and it's sometimes hard to get the public health voice heard. Thanks for sharing that. Okay, well, let's move on into policy enactment, which I know is kind of the hardest part, is can we get our policies enacted? But when it comes to advocacy, there is a big difference between education and lobbying, and a huge line for folks who are in positions like ours where we're allowed to be. And so most often it's our job to educate about best practice in public health problems, but not to lobby. And other partners and influencers you work with in the state can help make sure that you avoid being on the wrong side of advocacy. But we have to make sure that we're really staying within our role. And so this kind of also plays a big role when we're thinking about what are we actually going to engage in at all or speak out on, and where are we going to interact with our partners when it comes to advocacy work. But so in Colorado, we have a pretty formal process here for figuring out whether we're able to testify or support legislation, and who does our lobbying. And so for us, our Prevention Services Division of the Department of Public Health, we go through our legislative liaison here for everything related to legislation. So we don't have contact outside of that unless we go through her. And there's actually a standard form that we fill out when we request a position on legislation or request to testify, and that's our formal process to make sure that everything goes smoothly and that we're following the rules. So do other folks have different processes to be able to testify and support legislation?
This is Jeannie again. Sorry,
That's great.
Here, it's a good question because I have not ever, like, probably maybe 20 years ago, we had people that were able to do that, but now I have not encountered or don't even know. Peg can maybe chime in on if we could even asked to testify through our jobs. We can do it, you know, on our own, but we also would have to let somebody internally know that we're there on our own behalf, but to be there on the state, our job, in our role of our job, I do not know if there's even a process to even fill out a piece of paper, and highly likely we wouldn't be able to go anyway, but do we even have a process like that, Peg? Do you know, internally?
I'm not 100% sure. I think our best bet would be to find a partner to go on our behalf. That's usually what we do, and that's probably always going to be our easiest way to get anything like that done.
And often that I think that's more strategic anyway, right? I think often nobody really wants to hear from public health, or it might not be the right situation for public health to speak out. And for us, we very rarely are weighing in, but when we are, it's usually just on the data to be able to provide a non-biased perspective on what the data tells us.
In North Dakota, our process, well, our process hasn't changed, but due to our governor being more of, our current governor being more of a businessman / marketing person, we've actually been able to testify in support or against bills, which is kind of a unique situation for me, because usually we were just approved in the past by the governor to provide information as like a neutral testimony. So it's kind of been an interesting difference for us, but we just have to go up the chain. Like, I have to receive my supervisor's approval, and then my supervisor goes to our state health officer, and then the state health officer goes to the governor's office to receive approval. And every time we've asked to testify in the last legislative session since we've had the new governor, it's always been approved.
Wow, that is really unique. It's exciting to be able to be engaged. Okay, well, let's move on here. The most important political office is that of the private citizen. I always think about this and think about how community members can have the greatest impact telling their stories and getting engaged, and it means a lot to legislators and advocates to hear from them. So Jeannie, like you were just saying, you know, we might partner, or Peg we might partner with other folks, and that might be a good opportunity for them to be able to speak out on an issue. And I think oftentimes that makes more sense for people to hear from. So let's see. Kind of the last thing I wanted to talk about here was legislative trackers. So we use legislative trackers in Colorado to keep our partners updated and kind of keep our fingers on the pulse of what's happening in the state. And so we have a few different trackers that we update every day. And our process is to organize these based on, you know, kind of the broadest category of injury and violence prevention. So any bills that we think we might want to watch just because it might impact some of the issues that we work on. And then we have some more specific trackers around behavioral health, economic stability and supports, any marijuana-related legislation, motor vehicle safety, opioid-related legislation, suicide and firearm, and sexual health and sexual violence. And then we also, we don't maintain this page, but we also link to a health equity and social determinants of health tracker, which, as you can see, we haven't updated yet. We need to find a partner who's working on that. But we think that based on our partners' makeup and based on our branches' makeup, that this is sort of these are the categories that folks are looking at legislation through. So the idea here, this is actually on our partner blog, that we can update these daily. And so partners and internally, our branch members can come here and see, okay, was there anything introduced today related to the issue that I work on, sexual health and sexual violence. But then, as I think a lot of you are doing as well, we also work a lot on shared risk and protective factors. And so thinking about how we can categorize legislation when it relates to more of our broader strategies and priorities of behavioral health and economic stability. And so this is what we use to keep folks updated. And then just so that you can see, this is just the example of the motor vehicle tracker in particular. This is how people will view it. And actually it feeds into this. We use a state bill tracker website to add bills to each of these trackers. And then this is what folks see. And this has nothing, you know, we have a disclaimer on the website too. This has nothing to do with whether the Department of Public Health is in support or opposed or has any position whatsoever on this. This is just purely to track this legislation might impact this issue, regardless of whether we have an opinion on it. And oftentimes we don't. And so at a glance, you know, we can see what the bill is called and what the number is on the legislation and where it's at, whether it's made the calendar yet, and when we can look out for that, and any recent updates from the news cycle, and the bill sponsors, and when it, you know, what its status is. So, so this is just one example, but I'm happy to send out the link to the rest of our trackers as well. So I was curious to know if you all have methods to keep your partners aware of any legislative changes or legislation, or even if that's something that you take on in your role, because I know that not everybody does. So is that a role that you're expected to play in your state? And if so, what do you usually use?
Here in Kansas, Safe Kids Kansas has an annual policy platform and priorities that they develop, and so then the legislative liaison can speak to any of those items. If there's anything additional that comes up during the legislative session, then that is shared out through the listserv, and the board has opportunity to direct the legislative liaison.
Great. I think someone else was going to speak up too.
Yes, sorry.
Oh, go ahead,
I'm
Jamin.
sorry. This is Jamin Johnson in Wyoming. So we have a similar tracker to what you described, or dashboard rather, but it's not public facing, and I think your question pointed out sort of an area where I think we can definitely do better. I don't think we necessarily do a great job of publicly communicating the impact of legislation on the work that we're doing to our partners. So I guess I'm curious to learn how other states are addressing that.
And Jamin, I know you said that wasn't public facing, but if it's something that you are able to share, I'd love to see that, but again, only if you're able.
Sure, I will. It's maintained by our by the director's office. I'll ask if I can share it.
Great, thanks.
I was just going to say, in North Dakota, we just do something pretty informal. It's just a Word document that we put together and just have all the actions and then send it out to our Injury Coalition during our session. So we don't have anything online. We just send something out via email. So it's pretty old school.
Great. I think that old school works for a lot of our partners, so that's great. And Ashley Nick says, as for keeping partners informed, I think coalitions or alliances like the Colorado Young Drivers Alliance is a really great way to keep our many partners informed about legislative changes, because there are so many voices at the table that can speak to different parts of legislation. And I think that's really true. And it's nice to have those in-person or over the phone communication as well, and not just have it be one-sided with, you know, sending out updates about this. So that's great that you're continuing that conversation.
I was just going to add, I think the alliances are really key in terms of finding workarounds for what we can and can't do in terms of like the advocacy and the lobbying, and why those partnerships are so strategic, and that they're able to do more and are more flexible in those spaces than we are.
Definitely. Thanks, Felice. Okay, does anyone else have anything to add here? Okay, well with that, anyone have any questions or also anything that you want to post to the group or resources that you want to share, best practices, any final thoughts?
I guess I'm kind of curious about how many folks actually have kind of formal advisor groups or alliances or committees or what have you. How many people use that as a platform and find it to be effective, just out of curiosity.
Here in Nebraska, just for motor vehicle safety, we have a Drive Smart Nebraska group, so it's like probably about 30 to 40 people, and so we utilize them a lot because they can do way more policy than we can, and we're pretty informal too. Kind of what North Dakota is they actually probably inform us more sometimes than we inform them because they're there, they're at the Capitol, you know, working directly with the senators and everything, so they probably inform us more than we may do for them, and by default, because we do legislative reviews, we may find out something that they're not aware of, so it's a really good partnership of give and take and sharing information and getting that out to that group, and then they can share it further. So yeah, we rely heavily on them.
That's awesome. We work really closely with Drive Smart as well. They're great partners.
I think in Utah as well, a lot of our coalitions have a stronger tie to what's going on at the Capitol, and we work through them a lot, and they receive information from us too. One interesting thing that is going on in our bureau, so in Utah, the Violence and Injury Prevention program sits within the Bureau of Health Promotion, which includes a lot of other chronic conditions. And for the Bureau, they've recently kind of created a position that's both a policy coordinator for the Bureau, but she also oversees our primary prevention efforts, which include social determinants of health and health equity. So our Bureau is kind of trying to look at health equity through a policy lens for all of kind of violence and injury and chronic conditions. I don't know if anybody else in this call sees kind of a similar shift that their programs are also working on. Policy not only for topics, but kind of at that health equity level as well.
Wow, that's great.
Yeah, that's
I don't
really
know that
awesome.
I don't know that we're seeing a shift policy-wise and how to drive change for more equitable health, but I know that that's something that we're really committed to just within our branch and our division. Yeah.
Yeah, I'm pretty excited by it too and interested to see what comes of it. It's a new position, but I'm sure we'll be letting people know how it's working as it gets rolling a little bit more.
Yeah, please keep us posted.
Yeah, definitely.
Well, I know we only have a minute left. Any final thoughts? Okay. Well, thanks oh, were you gonna say something, please?
I was just gonna say, great job, Kate, stepping into the breach.
Thank you. Thanks everybody for bearing with me. And thank you for being so engaged. And I am not sure exactly when our next learning opportunity is. I think in a few months. So I'm sure Colleen will send out more information about that. But in the meantime, if resources or best practices or experiences pop up, please do send an email out. I think we'd all love to hear from folks and hear about how the session's going. And I guess next time we talk, we might be done with a lot of them, which is funny to think about. But keep in touch.
Thank you.
Thanks, Kate.
Thanks, everybody.
Thank you.